Good day. I am Dr. Wilfredo S. Tagle, urologist, and welcome to Medical PracTIPS. It is a series of tips and tricks to help you start your medical practice. For today's episode, we will be continuing on our series of starting your year right. Starting your year right is crucial to help you jumpstart your medical practice. One way to start your year right is to keep track of the requirements of your clinic. This includes the physical clinic evaluation, government requirements, your staffing, your process flow of your patient, and the financial flow and status of your clinic. For the clinical evaluation, which focuses on the following. Number one, engineering. Thus, the lighting of your clinic still good? Are there any busted light bulbs? Number two is the air conditioning or the temperature of your clinic is still aligned with the international standards. Then, are there any leaks when there are rains? Are the paint or the color of your clinic still okay or right or still bright? So those are the engineering. Are the furnitures still okay? Are there broken furnitures? Okay, so that's the engineering part. Number two, the equipments. All the equipments that you need are your computers. Number two, the refrigerators. Number three, the sterilizers, your beddings. So you still have to check all the equipments within your clinic. Are they functioning well? Are there broken equipments? So that's the time to evaluate all your equipments needed for your medical practice. And third are the essentials or the consumables. Do you still have forms? Number two, do you still have tissues or alcohol, sterilizers, gloves, masks, your sutures, medicines? So those are the essential consumables. Okay, so after checking all of that, we will go next to the government requirements, which is very necessary for the start of the year. Number one is the PTR or the Physician's Tax Receipt. Usually get this during the first week of the year. Then, before you can get the PTR, you must have a residence certificate to show that you are a resident of that particular city or town or province. Okay. Third is the BIR or the local taxes. Still have to take care or pay the professional tax for the BIR and other local taxes on the first month of the year. Then next is the PhilHealth. You check if your PhilHealth accreditation and membership is still okay. Is it expired? When does your PhilHealth membership expires? And of course, attached with the PhilHealth is your PRC ID and your driver's license. You tend to go around and sometimes forget or neglect that your PRC and driver's license could be expiring, or sometimes it is expired. So that would be the best time to look and evaluate those licenses. Then, clinic evaluation. Is your clinic still functioning? Do you still have patients? Do you still have your secretaries and other help that you need? And of course, with that, if you are renting your clinic, you see to it that your rentals are fully paid for the last year, and you have to give the advance payments for the succeeding years, or specifically for this year. Next, you have to take care of the requirements of your staff. Number one is their workload. Are your secretaries, or is your secretary still can cope up with the workload that he or she has? Number two, because as you increase your patients, the workload of your secretary also increases. Then, salaries and wages. You have to evaluate the salaries of your secretaries. Remember, they are your personal employees. You have to take care if they are still equivalent to other employees in other institutions or other businesses. So they would stick with you. And lastly, the benefits you are giving to your secretaries or to your staff. Are they given sickness benefits, vacation benefits, other benefits like uniforms, and of course, some psychological improvement, so they would be happy for their jobs. And a happy staff would means a better production or increased productivity to your clinic. Next, financial evaluation and requirements for the year in your clinic. Number one, you have to evaluate your daily sales or income. It is very important for any other business. Remember, your clinic, your medical practice is your business. So you have to evaluate your daily sales. Is it increasing or is it decreasing compared to last year and the year before that? Number two is the collection. Can your patient still collect the services you have given? Because nowadays, there are a lot of collection process, but sometimes we are not able to collect them all. Number three, accounting purposes. You have to have your accountant, your bookkeeper, and of course, with their help, you can backtrack and evaluate your financial standing. Are you in the red or are you in the blue? Next is recording. It's very important your records are properly kept. So you can keep track all transactions, all financial processes in your clinic. Next are the collectibles. With the advent of PhilHealth, HMO, insurances, you tend to have a lot of collectibles. You have given all your services, but the collectibles comes later. Okay, so you have to keep track on your collectibles. Next are the payables. Of course, if you have collectibles, you have payables. Sometimes medicines and other materials are given to you or through your clinic in a 30 days and other transactions. So you have also to remember and keep track your payables. And lastly, that you have to control, very important, expenses. Sometimes we neglect expenses in our clinics, even though it is just a minute amount. But when evaluated for the whole year, usually it becomes huge and very significant expenses on your finances. Okay, so that's it for today's episode. Like, follow, and subscribe to our Facebook and YouTube page to catch the latest episode of Medical PracTIPS every Wednesday, 7 p.m. Please share this episode of Medical PracTIPS so we can help more young aspiring doctors build their practice and better serve their patients. Okay, see you. Bye-bye.